Good afternoon, everyone. Today's info session, we're going to explore the Mental Health First Responders Program. First, we ask, what is mental health? Mental health refers to a person's emotional, psychological, and social well-being. It affects how people think, feel, and act. It also determines how they handle stress, relate to others, and make choices. In recent years, there has been a noticeable increase in mental health concerns among young people. The growing concerns is not without reason, as research has shown that mental well-being plays a crucial role in the overall development and the future success of individuals. Adolescence, in particular, is a period of significant change and transition, both physically and emotionally, making young individuals more susceptible to mental health issues. Various factors such as academic pressures, the influence of social media, that's a big one, family dynamics, and peer relationships contribute to the challenges faced by today's youth. It is imperative that we recognize and address these issues early to ensure the well-being and resilience of young individuals as they navigate the complexities of life. Adolescent depression and suicide amongst youths ages 12 to 17. Studies show that 15.1% had a major depressive episode, 36.7% had persistent feeling of sadness and hopelessness, 18.8% seriously considered attempting suicide, while 15.7% made a suicide plan, and 8.9% have actually attempted suicide. Depression, anxiety, behavior disorders by age. If you can look and see, depression seems to be highest between the youths 12 to 17, and anxiety climbs also between the ages of 12 to 17. Here, behaviors disorders seem to be at 6 to 11 years old. Now, I'm here to introduce the Mental Health First Responder Program. Okay, this is going to be a program that's rolled out in Campbell County community in Virginia. So the Mental Health First Responders, the Youth Mental Health First Responders Program is a groundbreaking initiative dedicated to addressing the mental health needs of adolescents. Our program aims to equip parents and community members with the knowledge and skill necessary to identify and respond to mental health issues in young individuals effectively. Our aim through our specialized training sessions, participants will learn how to recognize common mental health issues such as anxiety, depression, and self-harm, among others. They will also gain valuable insights into effective communication strategies, crisis intervention techniques, and available resources for seeking professional help. This slide will show us all the warning signs that one can look for, feeling worthless or hopelessness, loss of interest in things that he or she used to enjoy, crying, inability to sleep, or sleeping too much, loss of appetite or increased appetite, withdrawal from friends and family. These are all warning signs that you can look for. The mental health First Responders Program will have several partners. The first partner is Campbell County Sheriff's Office, County Department of Public Safety, Emergency Medical Service, nonprofit organizations operating within Campbell County, such as Leadership Alliance Millen Initiative, will partner with the program to improve health care access. Government authorities, county and state health departments, others include local educational institutes and hospitals The partnerships will help lower mental health problems among the youth. So, our mission, goal, and objective of this program. Our mission is to promote and prioritize the mental health of young individuals by raising awareness, providing support, and fostering a safe and inclusive environment for their well-being. Our goal is to reduce the prevalence and the impact of mental health issues among youth by implementing effective strategies and interventions that address their unique needs. Our objective is to increase awareness by educating young individuals, parents, educators, and the community about the importance of mental health and its impact on the youth development. This includes promoting awareness of common mental health disorders, destigmatizing mental health issues, and encouraging open conversations about mental well-being. Very important. Okay, now that we have went over some background information, let's get into what to expect within the next 4 weeks of your training. So as you know, the duration of the training is 4 weeks. We will meet for 4 hours a day, okay, where we will be covering the introduction to youth mental health, which is going to dive into understanding the unique challenges and developmental stages of youth, recognizing common mental health disorders in adolescents. We're also going to cover communication and engagement, which is very important in this line, this field. Effective communication strategies with youth, building rapport and establishing trust. Active listening skills is also very important. Assessment and screening, conducting mental health assessment for youth, utilizing standardized screening tools, identifying risk factors and protective factors. Okay, treatment approaches for youth, evidence-based therapies for adolescents, tailoring interventions to the development needs of the youth, crisis intervention and suicide prevention, recognizing warning signs of suicide, risk in youth, responding to crisis situations and providing immediate support, collaborating with emergency services and mental health professionals, collaboration with parents and guardians, engaging parents in the treatment process, educating parents about mental health issues in youth, providing guidance and support to parents in managing their child's mental health. We're going to also cover collaboration with the school psychologists and educators, working within the school system to support students' mental health, advocating for appropriate accommodations and support services, collaborating and prevention and intervention strategies, collaboration with pediatricians and health providers, understanding the role of pediatricians in youth mental health, coordinating care and sharing information with the health professionals, addressing the physical and mental health needs of youth holistically. Cultural competence and diversity awareness is very important also. Recognizing and respecting cultural differences in mental health, addressing the unique challenges faced by diverse population, incorporating cultural sensitivity in assessment and treatment approaches. Then finally, the most important part is going to be self-care and professional development, promoting self-care practices for mental health workers. Because if you're not good, it's no way you can function and be an asset to this company and help people. So self-care is very important. It's going to be a very important part of this job. Managing various traumas and burnout, and continuing education and staying up to date on research and best practices. Okay, so we will succeed, and I believe we will succeed. And why would we succeed? Our mental health program will make a significant impact in the lives of young individuals and their families. Because of you, our dedicated and compassionate employees who are at the forefront providing exceptional care and support to address the mental health needs of the youth, you will witness the positive transformation in the lives of countless adolescents, empowering them to navigate their mental health challenges with resilience and hope. That's why we're going to succeed. That's why. So on that note, I welcome you all aboard, and I look forward to working with you and getting to know you within the next 4 weeks.